me know. Okay, good afternoon. Welcome to Track E, Leadership in Action. I'm Bob Audette, the partner lead for data management practice at Guidehouse. Really have a distinct pleasure today to help kick off today's session. This is going to be focused on data analytics and AI leadership in action with a great panel. And really today you're joined by leaders within PwC, CIOs, CDOs, really from New England healthcare companies and organizations. Really, this is going to be an interesting conversation on improving patient and also member experiences and long-term care outcomes associated in using data and analytics. A couple sort of logistical things. The session is going to be recorded. The actual video will be available about 3 months from now via the YouTube channel, the MIT YouTube channel, and also for Q&A. We'll start with questions within the room. And for those that are joining virtually, please use the Wahuva app and pose your questions, and we'll help to kind of moderate the questions toward the end. So let me just briefly introduce Abbas Mooraj. He's a partner of cloud analytics, AI, and digital for healthcare and life science at PwC. He focuses on health systems, establishing vision, strategy, foundations for cloud-based enterprise data and digital platforms to drive analytics and insights across the organization with substantial amount of experience in the healthcare space. Global management partner for healthcare at Cloudera at a certain point in time. So I guess with that, Abbas, I'll have you introduce the panelists.
Thanks, Robert. Just grab the mic from you. Robert, thank you for the introduction, and thank you to the MIT CDOIQ conference as well for hosting us. Thank you for being in the room. Thank you. I think we've got about 150 guests virtually as well, so thank you all for spending an hour with us on this afternoon. Given that we're at MIT, this is a wonderful, esteemed panel that focuses on the patients, the members, the communities in our New England healthcare, where we're going to talk about data. We're going to take a deep dive into data and the impact that it's having in the community for these patients and members. So that being said, I wanted to give an opportunity for Mr. Jawad Khan to introduce himself and his organization, a little bit of background.
Happy to be here, Abbas. Thank you so much. Jawad Khan. I'm Chief Data and Analytics Officer at Tufts Medicine. Tufts Medicine is local here in Boston. We have a Tufts Medical Center just not far from here. We also have 2 community hospitals in Lowell General and Melrose, Bedford area. We have over 40 provider practices, outpatient ambulatory clinics. We are the largest home healthcare, care at home organization in the East Coast. And, roughly over 3 million covered lives through our managed care patient population. And that's who we are.
All right, again, hi, thank you, Abbas, again. I'm Rahul Jaglekar. I'm from Point32Health. And Point32Health, some of you might know, is a very recent merger of Tufts Health Plan and Harvard Pilgrim Healthcare. So we are basically a healthcare payer. I'm a part of the CTO organization, mainly into data analytics, AI space. And we practically have every data platform that you can name over all these acquisitions and working through all these different data challenges, and we'll talk about them. I'll hand it over to you, Beth.
Thank you. Hi, I'm Beth Falder. I'm the AVP of Data Management and Analytics for Nuvance Health. So Nuvance Health is a hospital system in New York and Connecticut. We have 7 main hospitals and over 40 practices for our medical specialties, along with a number of home health agencies as well. So as part of my role, I provide all of the data and analytics oversight and am truly the steward of all the data across the organization. Hand it over to you.
Last but not least.
All right. Hi, thanks for having me and this amazing panel that I'm with. My name is David Yu. I am the Chief Information Officer at Blue Cross Blue Shield of Vermont, and also the data organization reports into me as well. It's an effort that we actually took a while to do, is just bring all the data folks together, because there's the spirit throughout the whole organization, and that's how the data organization is now part of technology. And in fact, what I would almost say is, I'm not a technology organization. We happen to have both the technology side of it along with the data side of it. We are the biggest plan in Vermont. We're a small plan, and one of the things that we deal with a lot is rural medicine, is how do we actually reach rural medicine and a lot of our members beyond just the, I was going to say metropolitan areas, but it's Vermont. There is no metropolitan areas in Vermont. So anyways, glad to be here, and really excited to be kind of sharing our stories with you all.
Wonderful. And on behalf of the MIT conference, and thank you for spending your time with us today. But so I wanted to begin, so just in terms of logistics, we wanted to go, Robert, till about 50 off, and then have about a 10-15 minute Q&A at the end, right? So Beth, let me start with you. Like this is I think this is going to be a fascinating discussion. Just we wanted to be open and transparent. So you manage such a diverse group of business leaders, right? In one day, and I mean we've talked about this, clinical, pharmacy, research, finance, HR. That's just the morning for you at Nuvance Health, right? How do you not just balance, but how have you set up your data organization to drive value? And this is what this session is about. It's not just the data, it's the insights from that data. And how are you driving value at Nuvance Health?
It's a difficult question to answer for sure. I am responsible for all data assets throughout the organization, and as you can imagine, the requests are plentiful. So how do we decide which areas we want to focus on, what's strategically the most important for the organization, and then how do we deliver that value and ensure that it continues to deliver value? So I do have the team structured in a way where I have analysts who dive into the data to look for those opportunities, and they are direct dyad partners with those different organizations, as you mentioned, so HR or a clinical area of expertise. They're critical to the organization. They then partner with my data engineering team, who are responsible for the back end, building those data pipeline, ensuring the data integrity and the quality, so that what we deliver is true and does provide that insight that the leaders are looking for.
How do you, and one of the I know this is a cross-industry conference, but obviously this is a very focused healthcare one, where we want to learn from other industries, and hopefully other industries learn from healthcare as well. But given the HIPAA regulations, the non-sharing of data between even a payer and a provider, health insurance or health system, how do you deal with non-patient data? How are you dealing with the amalgamation of external data that you get with internal data, finance data? How are you dealing with all of that?
Absolutely, and that's where master data is key. So you have to be able to crosswalk that together to ensure that you have that data lineage and the ties so that it matches, and is tied to the direct account that you're speaking of, or encounter, or whatever domain you decide to key that off of. So it's not a perfect science, and it does take a lot of work. It does take partnership with the business as well. This can't be an IT function. It has to be a cross-organizational function. So we try and bring in as much as possible. The organizational leaders get their buy-in, get their sign-off, get their insights into how this should be structured. We're working on that. That's a journey, because not everybody realizes the work involved in being that data steward, and that it isn't an IT function. So as we grow, as we see data as an asset, that is something that we as an organization are changing a little bit.
Okay, wonderful. David, I'm going to turn to you for a second. Now, with your perspective, given that you're a CIO and the data organization rolls up to you, how have you managed to focus your data both on the business side and the technology side together to sort of drive value? Like, that's one of the things I'd love to know from you.
Yeah, thanks, Abbas, for the question. And I'm actually kind of sitting here going like, if I'm sitting out there, what do I want to hear? That's not like every stuff that you hear at every conference. And I think all of us have different challenges and different responses and et cetera. Let me share. I'll share kind of my perspective, not just And we actually had dinner last night, the five of us, and we're kind of chatting about what do we talk about, et cetera. And I think one thing we thought we said clearly is let's just be honest and transparent and just talk about not just how we solved anything. Is holy cow, we got just as many problems as you all do. And I say you all because I live in Austin, Texas, and even though I work in Vermont, yes,
Austin's in the house.
Longhorns. Yep. One of the things when I came into the organization, what I noticed really quickly was the fracturing of who owns data. And it's like, it's the weirdest thing. We had a data organization at the clinical side of the organization. We had actuarial on the finance side. We had data and operations. We had data and IT. We had data freaking everywhere. And what we realized quickly was no one trusted that data. Everyone basically said, my data is better than your data. I'm like, well, it's the same damn data. How can yours be better than this other person's data? And so what I did was I worked with actually throughout my executive team and my CEO and said, hey, look, we're not getting the value out of this organization. We're getting a fractional value. And by the way, the technology team don't trust the business side. The business side don't trust the technology. It's like, you know what? Why don't we all put them together and just say, figure it out. Work it out. Stop with this whole bickering. Stop with who owns data. Stop with who's right and who's wrong. So what I did was pull all of the business data folks, the IT folks, and probably one of the more smarter things I did was I actually put the business data leader on top of technology and said, you keep complaining about tech, here you go. You own tech. You own the data. You own the infrastructure. You own the input-output. You own all of it. Now tell me what is your problem in getting value out of this data. And so what we do is we collapse the organizations. We actually pulled our IT data folks, rolled them into and we actually renamed his position. It was some like super long health economics director, blah, 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 comma, analytics, comma, data, comma, health exchange person. And I said, no, that doesn't make any sense. We'll call you, we renamed the role to the chief data officer. That role is not only data, analytics, and a bunch of other stuff, and said, you own it all. And what we saw very quickly was the walls started coming down. And the walls came down because it was, well, the data's getting in there too slow. Well, then prioritize that data ingestion, work on that foundation. Reporting is wrong. Great, set up some data governance and basically figure out who the data owner is and say, hey, you fix the data or you tell me what the right field is. Or it was value. Great. Who's got the highest value? We'll work on it. Just tell me what you want. And so really, I think this sounds almost trivial, but what we said is let's bring the people together that don't want to work together and say, well, you guys work together now, get in a little room and come out with some solutions and really start to work on prioritization and kind of what Beth was talking about and saying, business, I don't own the prioritization. You own it. I'm not going to tell you what to work on. You tell me what to work on, and you guys, you own the business, work it out and tell me what the highest value is. And so being able to collapse and take down walls has just been a game changer around how we actually bring value out of the data we got and really start servicing the business where the value really is. And so, anyways, I know I kind of rambled out there, but hopefully that shed some light a little bit.
No, right on. I mean, I've seen that personally. I think with Jawad, we've seen that personally as well. About if there are two organizations and two different leaders and the C-suite, you collapse, you drive value, and you organize and you drive value even more, right? So, Jawad, let me turn to you. Last night at dinner, you said something fascinating about news feeds, and I want to know more about that. How are you driving value at Tufts Medicine? It's such a obviously an academic medical center. My family uses Tufts Medicine, so I'm intrinsically involved in this as well. So I want to hear from you, Jawad.
Thank you. Before I get to the answer, Abbas said this is a focused healthcare group. He missed one thing. It's not just focused, it's also balanced. He put two providers in pairs to balance the room because we don't get along, the providers and the payers. So he had to balance it.
That's because your data's incorrect.
So coming back to the question about driving value, I think that's the most important thing, right? And like David said, we all are to some degree at fault for not promoting what we do in terms of data and analytics. If I ask the room today, what percentage of budget does data and analytics get assigned in your organization? You don't have to give me the answer, but you can analyze what that means from whether you are a data-driven organization or not, whether or not people put value in the work that you're doing. So it all boils down to the bottom line, where is the investment in data analytics and what you're getting out of it. In that environment, and I'm speaking from my personal experience perspective, in an environment where we only talk about being data-driven organizations, we just barely go beyond lip service. It's our job, then the onus falls on us, who are the data leaders, to sort of drive that value with what is available. And I was chatting recently with my COO, and we came up with an idea, or we were just brainstorming. Again, the idea is to see what works. And in our discussions, we realized that people, when they ask for data, sometimes don't even know what they're asking for. Other times when people ask for data, they don't trust the data that you provide them. And this goes back to what David was saying as well. So the challenge then is, how can we as data leaders manage the perception about what is the organization's data literacy? Where is data literacy? How are they able to consume the data? What are they able to do with the data? If you answer those questions, it turns out that the best way to do that would be to create sort of new stories with your data and analytics proactively that are relevant in the organization. So if the CIO is concerned about moving services from your acute care to more ambulatory care, let's start putting out stories that speak about what ambulatory care is, how it is functioning within the organization, what is the quality of the ambulatory care, what finances are being impacted. Understand that. So CDOs and CDAOs today have to completely align. Again, I'm saying this not because people are going to give you that alignment. We're going to have to go fight that alignment. We're going to have to go remove the friction, drop the walls, whatever it takes to go find that alignment so you understand where the organization is trying to shift, and you create stories about that shift. That transformation will really give you the value. The everyday reporting, and we discussed this notion about ask holes. People ask for information and they have no idea because you never hear from them. Sort of goes away if we try to proactively manage that data literacy program. We have to proactively manage that by creating stories that people are able to consume, like you're proactively pushing those stories. I think that's the way to do it, to sort of hone in, be proactive, understand where the organization is going, what the strategy is, and create stories with the data around those lines.
I couldn't agree with you more, Jawad. You said something yesterday at dinner, which we certainly speak about in our practice as well, is about CDOs have to be good marketers. They have to be good marketers. They have to be able to go in and convince the C-suite, the board, right? They should be meeting with the board on a frequent basis and giving them updates. And for example, one CDO that I work with, they've got their own executive dashboard up that says, here are all my data products. Here's all the direct cost savings, cost avoidance. Here's all the direct revenue impacts that we're having with our data products. Oh, by the way, this data product is driving 70% of the value. Perhaps we should invest more in that. So he gives a very factual report once a quarter to the board. And we'll get into more detail, but couldn't agree with you more. I think being proactive, I think getting the data in our world back into the workflow and doing more than insights and reporting, I think that's crucial.
Yeah, I mean, one example I would give is Tufts Medicine was going through a major transformation in 2023 where we were consolidating all of our EHRs. I'm just giving that as an example, anecdotal example that people can walk away with. And when you do any such transformation, you have to wonder what would happen to the data translation, meaning from one EHR to the new HR. Somebody has to do that conversion, right? And that same data would have to be then archived. Once you have converted the data from the old EHR has to be archived. And then the third is, by the way, what's going to happen to my data lakehouse, warehouse? Is this the old data, legacy data, part of the data lakehouse, warehouse? Typically, people approach this problem from three different perspectives. There are different vendors that do archiving, different vendors that do warehousing, different vendors that do data conversions. Like you said, it's all data. It's the common element between all these three solutions is data. So we, chief data analytics officers, need to understand that we are dealing with something that is a common denominator between all things related data. So we have to show value by saying that we're going to solve this problem by doing one solution, not three solutions, because it's one data, it's one analytics, it's one conversion, it's one warehouse, right? So it's very important. We can go on and on about how to drive value out of that by thinking out of the box, by aligning and actually doing it, providing it by simple, proactive approaches to this data would solve the problem. But
Yeah.
I
No,
agree.
agreed. So Rahul, I want to talk to you about something. I mean, you come at this also from a different perspective, right? You work for a steam payer, but you're in the office of the CTO, architect. Tell us a little bit about how you are driving value working with the data folks.
Yeah, so we have exactly all these same challenges that everybody here mentioned. On top of that, we have three separate lines of business. It's a merger between two companies, so data islands, all of that stuff is in place. And one thing that we debated a lot and wasted a lot of time was data warehouses versus lakehouse versus a data lake. And the answer is everybody will have a flavor of each one of these components. One of the big takeaways I'll have for you guys is don't or try and change the standard ETL to an ELT. Extract, load, and then transform as you need at runtime. That saves a lot of time and that gets you immediate value. So that's one pattern that we implemented, and we were very hard on implementing that pattern. Separate tools were procured and so on and so forth. The other thing that seemed to help is there was a general impression that data quality is bad, which is true across all organizations. But then one of the things we did was we introduced self-service analytics and provided all the right tools and reached both the data-wise and the analytics tool-wise right to the end consumer. So every business unit has analysts in there, and they're always very eager to learn. Everybody wants to learn, do AI, ML, and so on and so forth. And so all these drag and drop, low-code, no-code tools were provided, and that actually helped get some immediate value out of data. So while MDM and building out the comprehensive data lake is going on, these other things are really producing value that eventually will help automate some of the stuff that is planned for the future.
I think you brought up the perfect example what Jawad said, right, about data conversion. I mean, you're two organizations coming together with such legacy data. One thing about healthcare organizations, we never get rid of our data, right?
That is correct.
Right? I mean, data. I mean, we never get rid of our data. We never sunset our data. We never retire our data, right? It's always archived, but is it really archived? It's always available if needed, right? Which is not the definition of archived, right?
That is correct. And the data comes from not just your OLTPs or OLAPs. There's a lot of COBOL-based or legacy systems still in use, which actually supply our data warehouse and data lakes. And it's quite valuable data. And along with that, EHR data, which is all unstructured data, is a whole part of this equation.
Yeah.
Hey, Abbas, can I add?
Of course.
And everything Rahul said is spot on. So since I have a pretty unique role between IT leadership and data leadership, one of the things that we actually put together, kind of aligned to what Rahul was saying, was we actually put together a fundamental pivot and a shift in our strategy and architecture in relations to both data and technology. And this is where I think the convergence of it is pretty important. So within all of our organizations, I think Jawad mentioned the EHR, we got claim systems, we got membership systems, et cetera. We put together a new architectural strategy and basically said, and most of our organizations, I'm assuming, is not that dissimilar. Our transaction systems are still at the center of the universe. Everything's about the transaction system. At least in our settings, it could be our EHR side of the world, claims management side of the world. I'm sure in education and student management, enrollment, et cetera. And we really took a look at that architecture and flipped it a little bit And what we said was, no, transaction systems are not the center of the universe. And so we actually built a new architecture paradigm where we actually put the data ecosystem in the middle. So we shoved all the transaction systems out. We shoved all of the engagement systems out. And we actually put the data ecosystem smack in the middle. And the data ecosystem comprised of data hubs. And we don't talk about real time. We don't talk about batch. We don't talk about EDR or data repository, data lake. We just, what we asked is the question is, what does the data need to serve? And everything needs to come through the data ecosystem. And that data ecosystem is what essentially feeds everywhere else. So for example, let's say we're integrating to a third party somewhere. That third party will come to the data ecosystem and get served to the transaction system. And this was presented both to the executive team and the board. And what we want to share with them is our focus has always been the transaction system. They're really more slave systems to the data. And we have essentially built our whole data strategy, not just data strategy, what I call is almost our corporate technology strategy with the data smack in the center. And if you all, like all your organizations is different, took a look at putting the data in the middle, what does your architecture look like? And what does that data ecosystem or data hub, what does it serve? Because why can't data come in through your API, feed the transaction system, simultaneously do your ELT, shove it into the warehouse system, and decide what to do? Why can't that all happen at the same time? Simple as, for example, in our healthcare world, we have things called like next best action. Simply translated into is, hey, one of our members, they should have gone and got an annual physical. They didn't. Should we remind them? And that's your next action, because that's kind of in their health condition. So what we can do is, as we get our feeds from the hospital systems, as it comes in, we can actually say, hey, you know what? Their 1 year ticker happened. We didn't get what we call an admin discharge or transfer, ADT feed. Okay, great. That event didn't happen. Now, can we now pipe into our data engine and say, what should they do? And then integrate back to the experience world, either through notifications, either through alerts, et cetera, and say, do something. And so as we looked into, everyone's got an architecture diagram, but if you just say, you know what, our world is going to be data-centric, and everything is going to surround it, how does that change how you deliver value? How does that change how you deliver strategy? And then how does that change in the value equation is how much money you're going to get to actually build it out. I read a very interesting story last night, this morning. It was Sweden and Norway. Apparently they got the largest iron ore in the country, and they like dug in, and it's like a city down there. And then they realized they actually have rare earths down there, rare earth minerals. Well, it's like 3 miles deeper, but they only progressed 15 feet a day. And that's kind of how I feel about data sometimes is you get 15 feet a day to get to the 3rd mile, and they don't really know if it's fully there yet. But I think that's kind of the journey we're on. I do believe many this is my personal philosophy, I think all organizations need to pivot and put data smack in the middle, and then figure out what are the surround systems you want to have wrapping around that data. And I think that just a mind pivot would have a pretty dramatic difference in how we actually take action, what we do, what systems we pick. Like, hey, look at that, system ABC. Which one actually will interact with my data ecosystem better than the other two? So anyway, just kind of adding on to your architectural
Jawad, you look like you're going to answer that. Yeah. David, couldn't agree with you more. So would we speak about the transactional systems on one end, and then you have systems of engagement on the other end, and then, as you call it, the data ecosystem. Some people have called it the systems of intelligence in the middle, but you have to have a two-way communications with the systems of intelligence. It has to have, whether it's digital, whether it's CRM, whether it's a native app that you build, in interacting with the data ecosystem. It's no longer a data warehouse where you just put data in. It's living, breathing data that turns into new data, right? And interacts with your customer, with your patient, with your member, right? In the appropriate way. Jawad, what do you think?
No, I mean, 100%. See, the idea of master data management, that's why it's so important. We need to understand and appreciate the fact that there's going to be so many different modalities of the data, especially in our in our practice, we have discrete data, unstructured data, imaging data, and then different source systems, whether it's a clinical system or it's a supply chain. Healthcare systems are not just healthcare data. We have supply chain problems. We have HR problems. We have our consumer patients are also consumers. We have that data sets that we need to acquire and manage. So it is critically important to understand how you are creating that architecture, what type of information can be served up for data and analytics to add value. How are you organizing the data? Today, if I ask myself and anybody in the room, is there a common data model that you use to store all kinds of clinical data and non-clinical data in a single instance? And the answer is very safely, I can say no, there isn't. And why isn't is the question. We have been at this problem for how long now? Healthcare systems and EHRs are not just from yesterday. They're from, we have been 12 years ago since meaningful use. And we still haven't figured out how to collect clinical and non-clinical data in a single data warehouse. What's wrong with us? No, seriously, it's a reflection. The point is that we are saying the right things, but we don't have enough energy to do the right things.
Not to date us, but HIPAA was enacted in 1996.
All of that is very, very important, but it's not leading into the action that I would want to see. And again, I am in the middle of this, so I'm trying to figure out how best to accelerate this. Mm-hmm. And we are doing everything possible to accelerate it, but I think it takes a village to sort of solve this problem. And I'm very excited with this new, and then, people would probably hate us if we don't say generative AI in this session.
Come on. I was trying to last as long as we've gone 30 minutes without mentioning
Seriously. So no, there are real problems I think we have to solve. I think that's what Abbas is getting at. We need to understand what our data warehouses, lakehouses are, whether they are not holistic in their approach. And then we can actually talk about how to use AI, generative AI, which is very, very exciting. We all are excited about it. But we really, really need to look hard at our data and how we're organizing our data.
Oh, good stuff. So we've talked. I just wanted to recap the first half of the session. We've talked about collapsing organizations, business and technology to drive value. We've talked about being proactive and having news feeds where the C-suite and the board can understand that, right? We've talked about the technology layer. Beth, let me turn to you for a second. Sharing about something that Nuvance, I think Nuvance is very proud of, is the analytics hub. Can you share a little bit about how it came about, and is it driving the value, and sort of what's next for the analytics hub, and what's your vision to take data to the next level at Nuvance?
Yeah, absolutely. So at Nuvance, we were two health systems merged into one with disparate systems, disparate reporting. Hard to find anything, and it was always head and pack. Okay, I need this. I think I go here, and I'm not really sure. So as part of the discussions and work that we were doing, why don't we have a central hub for analytics? And that bore into a website, the Analytics Hub. That's where we try and pull in all of the different analytical solutions that are out there, bring in others that aren't. It's not always web-based. We're trying to move more to the cloud-based, of course, but some are Excel reports, some are PowerPoints, but bring it all together so at least you have a single source to show the information. And then from there, look at your prioritization matrix, see what you need to transform further into those more interactive analytic solutions, which are fine as is. Some Excel spreadsheets are great, so let's just leave them there. But what makes sense to prioritize and dive into your engineering team, really come up with more solutions. A lot of it is interactive, so you want to bring in supply chain to merge in with your EHR, see where your purchasing is impacting, see where your shortages are, see what you're using for clinical variation as an example, where cost savings can be found. Those need to be interactive tools. Some of the other stuff doesn't need to be. So it's that fine line, but truly giving people an easy way to access the information and stopping a lot of that time wasting of trying to figure out the answer really was critical.
Yeah. I think we were chatting about one of the items you came across already in 24 hours is, I think it's called the data contract, right, with the business. Talk a little bit about how you're going to think through that.
Yeah, so as I mentioned when we first started, we have more requests than we have time. So what we need to hone in on is what's most important, what's going to bring value, and what are you going to continue to use? Because I can answer a question now, but is that going to evolve over time? Or was that just a one-stop shop? Because I don't want to spend all of my energy on the one-stop shops. I want to really do something that's going to continue to drive that value. And that isn't going to happen unless we start to bring in more of the business to agree upon and partner with us to say, yes, okay, I want to develop this analytics solution. I want to really dive into that data. That's going to take my engineering team probably a month, 2 months, 3 months to build. And then you're going to use it in this way and continue to use it in this way. And we can always partner and evolve that, but it has to be that partnership to show that value. And that's where we're evolving to. That data prioritization really is key.
Agreed.
I mean, one thing I want to augment is data prioritization is so important, and also equally important is what type of tools you prioritize.
Right.
So my team can spend years designing a semantic layer. Should I buy or build it? My team can spend years architecting a data lakehouse. Should I buy or build it? So those decisions are very, very important for us to be able to then focus on the real analytics value. If your organization is, I mean, you know your organization, we all know our organizations. If our organizations is more in tune to buy than build, then be it. But get to the solution and then focus on the things that you need to. I think that is very, very important. We miss that aspect. We spend time and again, many resources to do things that may not be necessary. Better just procure them and focus on the business value.
And I'll just add one more thing, that if you are buying a tool or even building it, think of it for a period of 3 years, no more than 3 years. Within that time frame, have the budgets lined up so that you will be able to replace it with the newer technology at that point. So, and that's generally not done, that's generally not planned for, and that's where most people get hit and start to fall back at the end of the day.
No, spot on. So Rahul, let me continue on with you. I mean, I'd love to, so we talked a lot about combining business and technology, but how is technology going to now, and yes, we're 37 minutes in, we're going to talk a little bit about Gen AI, but how are you using technology to drive the use cases for the future from a payer perspective? And give us some examples of what you're doing without obviously disclosing too much.
Yeah, sure. So I'll give an example of population health management, which we do in-house. So we have a good population health management program, entirely technology-driven and data-driven, obviously, where we go in and make predictions on what are your utilization needs in next 1 month, 2 months, 3 months, 6 months, and a year. And based on that, there is certain interventions that are done. So based on the utilization needs, if you are a Medicaid person, it's almost done on a weekly basis. And the nurse practitioners who are employed as a part of Point32Health will reach out. And the idea is that we want to keep you out of hospital as much as possible and as early as possible. And that's where some of the home health treatments, and that's where nurses making physical visits to patients' houses comes into play. A lot of this is driven by the data in our data lake and the models, the AI models that have been built over time, and the learnings we've had from some of our failed models, some of our successful models, and all of this ultimately has the reinforcement learning piece, which is the human in the loop that makes the decision.
Yeah, right on. So you mentioned something that's very interesting to me. I'm very passionate about it, and I think this group is as well. Is home health, right? So I'm sure we all have aging parents. I'm sure we're called the sandwich generation. But in terms of home health, care at home, digital health, whatever you want to call it, there has to be a real focus on that in the next 5 to 10 years, right? The silver tsunami is here. How are we going to track a patient when they need emergency care transportation to a long-term care facility, a nursing facility, and anything in between, the hospital, the physician? How are we going to track their meds what they're taking at these different organizations. So Jawad, let me turn to you because we've talked about this at dinner, and you've done a ton of work in this space. What are you doing with home care? Where do you see it going, and how do you see the interoperability between all these organizations with data?
No, thank you. I think you touched on all the key aspects in the question itself, so I'm going to just elaborate on it. Tufts Medicine Care at Home we have a very large home healthcare practice as part of our Tufts Medicine health system. And there is definitely data, a lot of research that shows that people are better at receiving care at home, especially if you're in very sick conditions. You're better off receiving care at home as long as you can maintain the quality and provide the service that is needed. Based on that idea, the hospital at home concept has become pretty prominent. All EHRs have facility and ability now to be able to provide care at home and ingest data as the care is being provided. The second important thing that is shifting in this aspect is that CMS have announced that they're going to be providing 25 to 40% more reimbursement for care at home starting 2025. So that will allow people now, because they're incentivized to shift care from hospital to home. We are then now very keenly looking at all the enablements that will make it happen, that will make care at home happen, because one, it is better medically, it is better for the people, and third, there's money involved in it now, or we are getting paid for it. Before, we were not getting paid for it. Now, how do those enablements happen? Again, technology companies coming together, people coming up with solutions. Remote patient monitoring is a very, very important aspect. If we can do remote patient monitoring and provide same type of visibility into what's happening to patients' conditions, and this is where some of the AI solutioning is happening, where we can see in real time any degradation in the patient's condition, whether we are able to monitor the patients remotely by using devices that we are putting on patients now, or even if we're not putting it, Bluetooth-enabled devices to collect vitals. There are many innovations happening around sensors that are put in people's rooms where you can detect if people are getting off the bed, walking, taking their meals. All types of innovations are happening. And we have experimented and continuing to experiment on all those aspects. We are now sending patients home with buttons that they're putting on their bodies, which are 14-day long lifespan, and they're degradable. You can take them off, put them back on, take showers in it. That continuously sends your blood pressure, your oxygen level, your heart rate, so that we can directly ingest into patient charts. So all that innovation is making it happen. But really, really important, and I want everybody to think about this, is there is research shows that people are happier at home than they're at the hospital. Infections are less at home than they're in the hospital. And there's going to be better reimbursements coming in 2025.
Will you share that data with Point32 and Blue Cross?
Oh my God.
Don't answer that. Don't answer that. So David, let me ask you this. I mean, we mentioned technology, we mentioned remote patient monitoring. All of this needs to be obviously secure. How are you thinking about this from a payer perspective, and how are you looking at the next 3 years in this area?
Yeah, I'm going to try to answer that without answering that, because let me kind of go back to the value question and around visibility. So when we talk about how to get visibility, how do we? One of the things I would say real quickly is some of your best friends, who people think are some of your worst enemies, need to be brought in your camp. Your legal team, your regulatory team, your compliance team, and your risk management. In fact, I would say anyone afraid of any of those got to pivot, because the fastest way to get board detention is put data as an enterprise risk. And especially when we talk about security, one of the things a lot of us are regulated by some federal something, right? I mean, we're regulated by HIPAA. A lot of you guys are probably regulated by a bunch of other stuff. Banking is highly regulated. We're just all in a highly regulated environment, and that protection of that data is critical. One of the things that I don't know if anyone watches security news, but everyone's heard of the MOVEit vulnerability, right? Yeah. And with the MOVEit vulnerability, I mean, we're getting hospitals hit, we're getting clinics hit, and that data is out there, and we're seeing a bunch of hospital systems now get hit, and et cetera. So, in fact, I just got an email from one of my hospitals saying, "Hey, by the way, your data got leaked." I'm like, Well, that's great to know. But what I would say is when we talk about data, especially around healthcare data is pretty sensitive data. Last thing I want, not no real big secrets, but I don't want anyone else to see my data. And so we design a lot of our systems with security first, but also we do this within high level of collaboration with our legal teams, with our regulatory compliance teams, et cetera, because what I realized, especially working within our organization, especially in the healthcare world, the sooner you bring them in, the sooner they can actually help with solutioning. Because if you bring them in late, all they are is just nothing but a wall. And frankly, I think they just basically are not helpful at all. And you've all probably been through that. And so what we do is we work pretty closely with all of the security folks. I have the CISO organization report to me as well. So when we talk about data, we do security first, we do regulatory first, we do data protection first, and all that is baked in at the beginning, and we don't wait till the end, we don't wait till the middle. And that way, right now, one of the things we're looking at is putting up a solution for our Medicare business on a platform, and our legal team came in and basically said, well, unless I can do this, this, this. Now, luckily, we're at the beginning stages of that solution, and by bringing them in, they're helping with solutioning, they're helping with designing, they're helping with all these things up front, so that we don't have to have them be the no people at the end, and then you can't deliver those solutions. So absolutely security first, but then really leverage the organization and make sure those parties that are usually the no people or the blocker people, have them be part of the solution people. And that's been a pretty big pivot as we continue to drive these solutions.
Yeah, I can I add one thing? Just for everybody to think through. I want to invite everybody to think through this. Security, and David just said that healthcare data is very sensitive. How many of you know what safe harbor is? So we have about 22 fields that are categorized as safe harbor, meaning those have to be protected, keep it anonymous for not to get people's personal data out in healthcare. Very, very important. If I scrape Facebook, I can guarantee you I can find more than half of the safe harbor fields. All of a sudden, when you move to the social media side, data is not as sensitive as it is when you come to the healthcare side. Whether we like it or not, we all are being actively tracked by your cell phones. It's not sensitive anymore because it's not healthcare. Why does data, I'm just inviting you to think, I'm not challenging, I'm just saying, why is data sensitive only in healthcare and not anywhere else? It's a question for all of us to think about.
Yeah, and I'll just add that do not worry, all of your data is already on the dark web. So
Not Blue Cross data, maybe Point32, but not Blue Cross data.
No data is anywhere. So in closing, I'm getting the nod to do. We have some Q&A. We've got some Q&A in the app as well. Beth, let me start with you. We talked about so many good topics, right? We talked about collapsing business and technology to drive value, a data hub, a one-stop shop for data. We talked about news feeds. We talked about dashboards for executives and reporting to the board. At least my opinion is, a CDO and a data organization is a mission critical function for an organization that's sometimes not funded as a mission critical function. But just in closing, from your perspective, thoughts for the future around driving value for healthcare data.
Yeah, I think everybody's touched upon part of that, and a lot of it is about telling the stories, being very transparent, trying to get up to that leadership level, really getting your executives to see data as the asset that it is, and funding that asset appropriately. And I know healthcare, we're subject to quite a few budget cuts right now, and that's an easy cut to make, so they think. But as Keynote even mentioned, bring back that value. Make sure they understand, yes, maybe the finance department showed a financial win, but that financial win was also part because your data provided the insights for you to get that win. So somehow we do have to change the dialogue, change the reporting of how the value is delivered so that everyone sees data as the asset and foundational to everything we do.
Here. Rahul, what do you think in closing?
So we didn't we left ChatGPT to the very last.
Very last.
We'll talk about that. So very quickly, if you are restricted with these HIPAA and some of the other regulatory methods, the way we have found this to work is use OpenAI on Microsoft Azure within your tenant. And that has worked very well for us. It is a model within your tenant. It's not exposing anything out to OpenAI. And there's several use cases that are being built using that. Beyond that, I'll also add, just from a technology standpoint, is there is open source models which you can bring in-house, fine tune it to a particular use case, and those models are working out pretty well. Even though they are LLM, they are task-based models, so to say.
Okay, wonderful. Jawad?
We take data security very seriously, by the way. I asked that question because it's an important question to ask. In fact, we are shifting the game a little bit. In our solutioning today, we are inviting people to bring solutions to the data, bring analytics to the data. We don't send data to analytics. So if you're a vendor who's expecting me to send you my data warehouse into your platform, you're not getting business from me, period. You're going to have to bring whatever solution it is to my data, because we want to monetize and protect our data. All the solutions that we have implemented at Tufts Medicine, be it our Lakehouse, we are working on some semantic layer platforms right now. We are inviting them to bring their solutions to our data. That is very, very important, and it's a shift. It's a shift in mindset. It's a shift in thinking. It's a shift in architecture. As data professionals, as a CDO, it is my responsibility to protect data, to promote data as an asset, to protect data as a product at the organization. That's my job. That's what I'm being hired for. And I'm focused on providing that. And that can only come if I protect the data properly, monetize the data, convert my department from a cost center to an investment, to a money-making department, because data is very valuable. That's my focus. And I would like to leave that with the as last
That's
words.
great.
Happy to invite questions.
Why a cost center where you can do a profit center? David, last but not least.
What I would, it was an interesting conversation we were having yesterday. Our system is broken. The healthcare system is broken. And I think one of the opportunities that we have, not only talking about translating data from a cost center to profit center to value center, all of that stuff, I think there's a tremendous amount of opportunity, especially around payers and providers, for us to collaborate and merge this data together. I mean, it's kind of the dream, which is around how do we bring not only non-healthcare data in, healthcare data in, provider data in, et cetera. And again, kind of going back to the almost original thing around breaking down barriers, we got to solve and figure how do we break down these barriers, and how do we actually utilize data. And one of the reasons I'm in healthcare is I fundamentally believe with this data, we can improve people's lives. We can improve their daily lifestyle. We can improve having a productive life, to the end. I mean, and I think in many cases the healthcare industry has failed that. And I do believe that through data, through collaboration, through barriers, or removing these barriers, we can really actionably improve people's life. So, and that's what excites me about this industry and the value what data can provide.
Yeah, here. The fact that 4 organizations are having this across 6 states in this room, this discussion, I think it's a good start. Yep. All right, so I think we're about 7 minutes left. We ran over a little bit. We've got a couple of questions on the app, but let me start with the room here. Any questions? Let me give this mic to you. Just your name and it's a question.
Yeah, my name is Juan Sequeira. I'm a vendor, so I work for Data.World. But Profit Center, I would love to hear an example of either something that you've done right now, you're planning to go do, concrete on how you are making money with data. Profit. I'd love to.
Yeah, so the earlier example that I gave about using a common solution for all data problems, we have saved our organization literally over $11 million in going live with our consolidated EHR strategy, because we did not think that there need to be 3 solutions for the same data. That's literally making money for the organization.
I'll just add from the Blue Cross world, our data organization is actually not only analytics and data management and all the MDM stuff, but we actually also are accountable for reimbursement management. So all of our the data organizations, not only in the analytics side, data management, we're also actually part of the business. And so reimbursement analytics, reimbursement payments. The other thing we're heavily in the middle of is care management. Is how do we then work with all the data that we have and actively go and help manage care for the individual, which at the end of the day reduces cost for us. So instead of just working on what I call data jockeying, we're fundamentally looking at how do we get embedded back into the business where, again, we're not a cost center, but we're actually a value center where we are actually returning money back to the organization or finding money that we can collaborate with. And frankly, the money's out there if we can go after it. And so we've really utilizing the data, and I think the word we used last night is for knowledge and action. And that has really changed the way the data organizations perceive this. What's it doing? It's the whole question. What's it doing for me? What's in it for me? And that's the things we're doing with right now is working directly with the business or being part of the business where data is driving decision making. And this is not like we're gonna get a better master data file. It's like, okay, who cares? It's what can we do with that? And it really has changed the dialogue. Is the data organization is fundamentally linked directly with the business side of the world.
Right on. Right on. Question at the back? Maybe just your, yeah, me give you the mic.
Yep.
Yeah.
Please use the mic because they won't be able to hear you.
Okay, yeah, just your name and organization and question, please. Thanks.
Jeffrey Dobin, thanks for joining. A couple different topics have come up around data monetization, prioritizing our data, or moving analytics rather than moving the data. Privacy-enhancing technologies comes to mind, and we see this being used more and more in healthcare. Mayo Clinic is talking about it. They're doing it. Humana is generating synthetic data. And when I say privacy-enhancing tech, for anyone who doesn't know, I mean synthetic data, federated learning, homomorphic encryption, things like this. What type of techniques are you looking at now to incorporate into your current data stream so that way you can make data sharing or insights more available to drive better patient outcomes or reduce healthcare costs?
Yeah, I mean, we are using solutions today to create sort of data IDs or unique IDs for the patients that are anonymized, but then they can be remapped to the patients. And they're platforms that we are actually we are implementing as part of our Tufts University Medical Center has a very strong CTSI, so clinical research, and as part of that, we are leveraging a vendor to do anonymization of the data by creating unique IDs. So that's one. The second is our architecture that we use today on the Lakehouse. We are using open source Delta Share, if you guys are familiar with the technology, to be able to share the data, where people necessarily don't get the data, but they visit the data. We allow them to visit the data. They see the data that we are exposing. They visit the data. They get what they need out of the data, and then they walk away. Data still stays in your environment. So those are the two solutions that I can speak from experience as what we have implemented at our institution.
Yeah, and I'll just add that synthetic data is really big. So with the help of some of our vendor partners and GenAI, we have been heavily doing synthetic data generation, which flows down into the non-prod environments as well as when testing out with newer payers and getting into newer networks.
The only thing I would add is we've actually looked into synthetic data, imputed data, all those kind of like we think data. And we are actually being pretty cautious of that because the question we're asking ourselves is, can we take action based upon that synthetic or imputed data? And right now, a lot of the answer is no, because again, and so we're being very cautious around how to actually leverage that in a production environment. Now, we are using it from a non-production to do analytics, but it is there's a lot of hurdles still today to go from the analytics of hypothesizing to actually using it in a production environment. Even as something as simple as race, gender, ethnicity. We can impute, but we can't actually use that data in a production environment to take action. And so there's still a lot of hurdles to go from what I would call imputed data, synthetic data, or whatever it may be, to production usage of that data. And it's a great use case that we want. It's one of those. There's a lot of things we want to do that where there are hurdles to get to. But I believe that adding that additional non-direct data is going to be critically important, especially when we get to the AI landscape, that I know we ran out of time to talk about, but definitely it's going to be critical as we get into the generative AI space in the healthcare in all industries.
Wonderful. Any last quick question from the room? Okay. All right.
Hi, good afternoon. My name is Kiran. I'm CEO of ASOP Global. So I've been working in this industry for almost 25 years, meeting all the data leaders across the world. Everyone talks about problems, right? It's very, very difficult, right? But I always ask them, what makes them happy if I give you a solution? So for example, in the discrete manufacturing supply chain problems, banking sector compliance, in the healthcare, for example, if I come and help you, right, what makes you and your business and your technology happy with one single solution?
You have a question? Are you getting to a question, or because we're running out of time? Question. You have a question?
A question, what particular area in the healthcare which makes your business and as a CDO, as a data leader, makes you happy to provide that solution to your business and your technology?
So I'll faster value from data.
Yes.
That is the high level.
High level. Oh, okay.
And making difference in patient lives. It's amazing what you can do with the data.
Yeah. I just want to use the last 15 seconds and thank you to the MIT CDO conference for hosting us, and just a big thank you for spending time with us. Jawad, Rahul, Beth, David, thank you for spending some time with us. And I hope this session was useful, it was insightful, and thank you again. I hope we move forward together. So
Thank you.
Thank you.
Don't
Thank you,
forget
guys.
to
Thank
give
you for
comments on
coming.
the session.